The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Ulster County Commissioner of Health and Mental Health. Joining me today is my co-host, our Director of Community Health Relations, Vin Martello. Good morning, Vin.
Good morning, Dr. Smith. And as our listeners know, we talk to individuals representing a wide array of organizations throughout the community that deal with various aspects of community health and wellness. And today's topic is one that's very important. It's lead poisoning and lead poisoning prevention. The EPA has dealt with the issue over the years with removing lead from paint, removing lead from gasoline, and we know that many communities are, as we speak, struggling with high levels of lead in their water throughout the nation. So it's a very serious problem. Dr. Smith, before we talk to our guests and introduce our guests, can you tell us a little bit about the negative health effects of lead?
Well, first of all, a blood lead test is the best way to measure the amount of lead in your body. Children are given a blood lead test to determine the level of lead in their blood, which is referred to as the BLL. Exposure can lead to serious harm to a child, and millions of children are being exposed to lead in their homes, which increases their risk for damage to their brain and nervous system. It slows their growth and development. It leads to learning and behavioral health problems as their life goes on, and hearing and speech problems. And we do have a number of children who are affected in our community, and we are very active in trying to prevent exposure to lead in homes. And we have two excellent programs which deal with lead poisoning prevention. One of them is led by our Director of the program, Donna Greenfield, is a health education coordinator. She coordinates the Environmental Childhood Lead Poisoning Prevention Program. She has worked in the health field for more than 20 years and has been with us at the health department for 4 years. We also have the primary lead poisoning prevention program, which is coordinated by our supervising public health nurse, Wendy Johnson. And Wendy has worked in the public health sector for close to 20 years. She's been with our county for the past year. Her background in public health includes maternal child health, immunization, as well as a previous position actually with one of our counties in this region, Dutchess County. She has worked there as a lead poisoning prevention program coordinator as well. So we really appreciate the work that both Donna and Wendy do for us to help the children in our community with respect to reducing the incidence of lead poisoning problems.
Good morning, ladies. So can you each tell us, starting with Donna, can you tell us a little bit about your program, Donna? Give us an overview.
Sure, of course. Good morning. So we're one of 15 counties in New York State that receive this funding to administer our primary prevention program. And what we do is we go into homes. We offer free home lead inspections for anyone that lives in the 12401 zip code who lives in a home built before 1978. In addition, we go anywhere in Ulster County for families whose kids have tested with a blood lead level of 5 to 14. We bring people free cleaning supplies, and because we know that wet cleaning reduces lead hazards. We also, our primary focus is to work with landlords because landlords are required to provide safe housing. We will go into private homes when we are requested to do that, and we're happy to go into private homes as well. So landlords or private homeowners also, as long as they're complying with the protocols of our program, get free packages to help them with their remediation costs. They also, we offer the EPA lead renovator class in Kingston regularly, and that class is also offered for free or at a very low rate in our sister counties of Dutchess and Orange. The goals of the program are to ensure we have no more poisoned kids and to create a workforce of people that can deal with lead hazards safely so they don't poison the people who live in the home themselves or their families when they go home.
Before we move on to Wendy's program, you mentioned homes built before 1978. Why is that critical?
Well, in 1978, the federal government outlawed the use of lead in residential house paint.
And you said there was a program that teaches, I guess, homeowners and landlords and contractors about removing lead-based paint?
Yes.
Why do they have to do that, or why?
Well, it's actually, there is a program for removing. Our focus is really, our requirement is remediation. So what that means is we're looking for stabilization. Lead in paint, if the painted surface is in good condition, is not considered a hazard. However, once that paint becomes deteriorated, chipping, peeling, any of that, it becomes airborne, it can mix with the house dust, and lead gets into our bodies either through eating it or breathing it in. So these programs teach the workers how to stabilize safely.
And Wendy, can you tell us a little bit about your program? I understand that you help parents whose children have been exposed to lead and families to deal with issues of lead poisoning. Can you explain to our listeners what you do?
Sure. The program that I work with, which is the lead poisoning prevention program, is primarily a two-pronged approach. I mean, we do a lot toward education, educating the public, educating community organizations that work with families and young children, educating providers and providing support for the work that medical providers have to conduct. And the other big piece is working with families with young children who have been identified with elevated blood lead levels, to try to work with them to make sure that the lead level goes down so that the lead exposure and the harms of lead is minimized.
And how do you work with them in terms of what do they do to bring levels down once a child has been identified with high levels? Okay.
Well, it starts with the blood lead test that Dr. Smith referred to earlier. All children ages 1 and 2 are supposed to be tested at their provider practice, and we receive the results of all those blood tests. They're filtered down through the state, so we monitor those blood lead levels every day, and when we see a lab report with a lead elevation, then we contact the family, we contact the provider, and make sure that follow-up happens. And I can get a little bit more into what the things are that families can do to try to reduce the risk for their children and themselves, if you'd like me to do that.
Yeah, sure, please.
Okay. Well, the first thing is, you can look at this in two different segments as well. One is care of yourself, and the other is care of the environment, which Donna's program clearly leads into. So once we know children have elevated blood lead levels, then our nursing department makes a visit to the home. We make a referral to our environmental people so that they go into the home and they can do an inspection to see where there might be a lead risk in the home, if there is. is a lead risk in the home. We provide lead risk education for parents, which includes talking with them about diet and how diet can help reduce the lead risk and mitigate some of the effects of lead exposure. We talk to them about maintaining their home environment, which Donna referred to, with wet cleaning methods. And one of the single most important things that anybody can do is hand washing to minimize lead getting into the body. And that has very much to do with children and what their behaviors are and how the lead exposure occurs.
And why is it that, I think I probably know the answer to this question, but why is it that pregnant women and children are most at risk?
Children and pregnant women are at the greatest risk of poisoning with lead, meaning the effects have more impact. Children's behavior lends itself to possible lead exposure if they're in an environment where there's lead. Because the exposure most likely happens through, you can call it eating, you can call it ingestion, whatever you want to call it, it's lead dust or lead chips getting into the person's body. And children use a lot of hand-to-mouth activity, if you've heard that term before. Children play on the floor, they play wherever they are, they're putting their hands in their mouth. So if their environment contains any degree of lead dust, then the risk of them getting it into their bodies from this hand-to-mouth activity is very great. Now, because children are at a significant rate of growth from birth through the ages of 6 years, that's also why it's very important for children to avoid lead risk exposure. And pregnant women they are the home for an unborn child. So if women have an exposure to lead, then they share the same blood circulation. So whatever their exposure is, whatever their blood level is, that infant, that developing fetus, is also at the same risk of exposure.
Thank you, Wendy. We're going to take a short break now. When we come back, we'd like to get more details from you, Donna, about how one goes about getting a home inspected and what that involves. So we'll be back right after this.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit HAHV.org to learn more.
Welcome back. You are listening to Healthy Ulster Radio. This morning, our special guests are Donna Greenfield, who coordinates the Environmental Childhood Lead Poisoning Prevention Program for our Department of Health, and Wendy Johnson, our public health nurse, who is coordinator for the Lead Poisoning Prevention Program as well. Donna, beginning with you, can you tell us a little bit more about the role diet and nutrition plays in helping to reduce the potential for adverse effects of lead in a child's body?
Absolutely. A kid who eats healthy food will absorb less lead into their body. So regular snacks that are healthy snacks versus fried food, that kind of thing, will absorb less lead. We know that foods high in vitamin C, iron, and calcium play a big part in this. In fact, we actively partner with ShopRite of Kingston, and we offer Fight Lead with Food nutrition programs, lead nutrition programs. We do a presentation about what lead hazards look like in the home, and then the dietitian there speaks specifically about these different nutrients. We then do a tour of the store, and we have little signs up that indicate where to find those foods high in vitamin C, iron, and calcium, and some of the sources might be surprising. And then people go home with a bag full of groceries. It's a great program.
And Donna, can you tell us, so if someone, a homeowner or a renter, suspects that their home may have high levels of lead or harmful levels, what's the first step? What do they do?
Well, they can contact me, and my phone number, this is my direct line, 340-3047. And call me. We'll set up a free home lead inspection, and our inspectors will go out. They're all wonderful people, very user-friendly. They'll I always tell people to make a list of questions because they will spend time and educate. We bring out some literature and also those free cleaning supplies.
So what is the testing procedure like, and what happens if they do find elevated levels in the home?
Sure. So we have a machine called an XRF analyzer, and we press that against a painted surface, and it identifies not just the presence of lead, but the percentage of lead. And then we also, depending on if the leaded paint that we find is the surfaces are completely intact, we'll also do dust sampling so that we can identify if there's dangerous levels of dust in the home.
And then, so if you're, like, say you're a landlord, for instance, and you say,
right,
I have multiple units and a couple of my units or one or more have been tested for lead and found to be high.
Sure.
Is there financial help?
Well, there is some help that we can give. So I'm just going to back it up a little bit, because if we find lead hazards, a letter gets sent to the tenant and a letter gets sent to the landlord that spells out what hazards have been found. The landlord needs to call me, and then we talk. And we set up a work plan visit so everybody's on the same page about the work that needs to be done. And we also offer those EPA lead renovator classes on a regular basis, and they're completely free. And so once the landlord has taken that class, we'll set up that work plan visit, and then we can give them about $200 worth of supplies, in addition to those supplies which include lead respirators, paint rollers, paint brushes, interior primer, all kinds of things, plastic to lay down, Tyvek suits, all sorts of things to make the process simpler and protect the worker. We also, if there were exterior porch hazards or common stairway hazards, we have free lead floor enamel that we can distribute as well, and that's based on square footage. We do as much as we can. I wish we could give money. It's just not the way the program works, but we do as much as we can to partner with our landlords. We want to have excellent relationships.
And if the individual homeowner wants to do the work himself or herself, do they have to take the courses and go through the instruction and follow certain procedures?
That's a great question. The EPA Renovate, Repair, and Painting Rule is geared specifically to anyone who's paid to work on home, schools, or daycare centers in those pre-1978 structures. They must be EPA lead certified. That's that lead renovator class. However, so the private homeowner, if they're doing their own work, is not required. But I always suggest that they do that. It's the safest way to go.
Mm-hmm. And Wendy, we know that the information about treating lead is for general information in terms of educating the public, and that individuals should always consult their doctor for specific treatment modalities. But can you give us just a non-technical overview of what a doctor what questions he or she might ask, what the parents should be prepared to cover with the doctor during a visit, and what would happen next?
Sure. Yes. First of all, I just want to reiterate that, again, that all children at the ages of 1 and 2 should be tested by their family practice or their pediatrician. So I just want to underscore that for anyone in the listening community to make sure that their children are tested and ask for those test results following that. What a physician might ask to identify whether a child's been at risk for lead exposure is, number one, because this is the biggest source of lead exposure across the board, is, do you live in a home that was built before 1978? Do you have any have you had any recent renovation or reconstruction? Because any of that kind of work can disperse leaded paint, lead dust, and that creates quite a risk for families with young children. And we referenced earlier the banning of lead paint in 1978. That is why we use that year as the benchmark. Another question that would be asked is what industry do the parents work in? Because sometimes the industry that a parent might be employed in could create a lead hazard exposure for the child. If a parent works in construction, reconstruction, sometimes landscaping, sometimes anything with dirt, anything related to lead and lead exposure that a parent may inadvertently bring home to their child. They ask that kind of question. They will also talk about whether there are any imported foods or products that may be used in the home that could create a lead risk just because standards for packaging are different from outside of the United States. So those are just a couple of the questions that could be asked. And a physician will then, and we support this, we will also follow up with families by letter or by phone, make sure that the child gets tested on a periodic basis to see what's happening with that lead number, that lead value in the blood, to be sure that that lead is coming down.
Mm-hmm. And is this something that you then work with the family over the course of time? Or what does that time period look like to say work with the family and make sure that they're on track and incrementally decreasing exposure and so on?
Well, unfortunately, there's no template for a time frame that would relate to each and every person listening right now, because each child exposure is different. Each course is different. Sometimes and it also depends on what that first lead level is. If it's a very high level, if the exposure at the time was a significant exposure, or if it's been an exposure over a period of time, those numbers are going to take a bit of time longer to come down. It could take as few as a couple of months. It could take as long as several years. But until that lead level is down into under a safe category, which is, we try to see that it gets down to 5 or below. That's just a number to throw in the air for people listening. Then we will follow up with physician and with families, just reminding them to make sure that that child is tested and that they're doing everything they can do to minimize the lead risk exposure.
And from your experience, does insurance pretty much cover the testing and all of that?
Absolutely. Yes, and it's different state to state, but in New York State, lead testing is considered universal, meaning all kids at 1 and 2 should be tested for lead. In other areas, there are different criteria sometimes, but insurance does cover it. If a family has a concern for their child and does not have insurance, they can be referred to us, and we will make sure that they get connected to an agency that will help them apply for insurance through the New York State Health Plan Navigator system. So, and if someone does not have insurance, we do have a mechanism in place that will help pay for that if they meet certain criteria. Mm-hmm.
And can you give us your contact information again and how people go about getting in touch with you and so on?
Sure. My direct phone number is 845-340-3065, and the program number itself is 845-340-3090. So anybody should be able to leave a message or get to me that way. Mm-hmm.
And Donna, can you give us your contact information and also how someone goes about signing up for a lead renovator course?
Sure. So my contact information again is 845-340-3047. To sign up for the course, call my number. We have a company that we contract with, and I will send you in their direction. And I want to just also name, we don't have a Fight Lead with Food date yet, but we are hoping in the end of September that we'll be able to schedule one of those classes again.
And to find out, you can go to ulstercounty.ny.gov/health and go to the lead programs, and that information will be posted. We also have a Facebook page Lead poisoning is a very serious issue. It's been on the radar for several decades now. It's fairly pervasive, and communities are still struggling with it. So we really appreciate the work that the two of you do, and really throughout our community, people who are really out there doing the work. Also, parents who follow up and are conscientious, and community leaders. It's a very important issue. Certainly our children are well worth any investment and that we can do to improve their lives and their futures and to make our community as healthy as it can possibly be. Dr. Smith, thank you for all the great work that you do.
Well, thank you. And I want to also echo your sentiments to Donna and to Wendy. The work we do in the health department to help prevent the poisoning of children with respect to their lead exposures is so important to this community, and we greatly appreciate all of your efforts. Thank you so much.
That's about all the time that we have for today. If you'd like to contact us for more information about lead poisoning prevention or any other topic that we deal with, or public health information that you can use to help keep your family healthy, please send us an email to healthyulsterradio@gmail.com. That's healthyulsterradio@gmail.com. And please join us again next week for more information that you can use to help keep your family and your community healthy and strong. Thank you.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.